Hello and welcome. So today I'm going to talk about two topics. One is lumbar triangles, another is anatomical snuff box. Okay. So first of all, lumbar triangles. By the name, you can say that it presents in the lumbar area. Okay. Now this consists of two triangles. Okay. One presents in the upper part, so we call it superior lumbar triangle. Another presents in inferior part, so we call it inferior lumbar triangle. Okay. Superior lumbar triangle, as you can see in this photo. It is also known as Grynfelt-Lesshaft triangle. Okay, the name is very important, and you have to know about the boundary. Okay, so it is bounded by the medially quadratus lumborum muscle. Okay, laterally it is bounded by the posterior border of the internal abdominis. Okay, and superiorly it is bounded by the lower margin or the lower border of the 12th rib. The floor is made by the transversalis fascia and the roof is made by the external abdominis. This triangle is clinically very important because it is the most common part for superior lumbar hernia. Now, what is hernia? I will talk about these things in disease chapter, not now. Inferior lumbar triangle, which is also known as Petit's triangle. Okay, name is very important, but you have to know about the boundary. It is bounded anteriorly external abdominis muscle and posteriorly latissimus dorsi. Okay, and inferiorly it is bounded by the iliac crest. Now, the floor is made by internal abdominis muscle and it is clinically important for Petit's hernia. Again, I will talk about this thing in disease chapter. Now, I'm going to talk about our anatomical snuff box. It is also known as Foveola radialis. Okay, this is just a triangular part presents in the posterior part of the base of the thumb. So this is the thumb and this is the base of the thumb. So posterior means behind. I mean this part. Okay, this part is the base of the thumb. So this entire area is known as anatomical snuff box or foveola radialis, as you can see in this photo also. Now, in ancient time, I mean not ancient, still now it is used still now used as sniffing of drugs. Okay, drugs like tobacco, cocaine, heroin, LSD, any other drugs. I will talk about these things details in forensic chapter, not here. So what they do, they put some powder, okay, put some drugs in this area and they sniff like this. Okay, I have to know about the boundary. The boundary, it is bounded by the medially extensor pollicis longus. Okay, now where is the medial lateral position of the hand? You know already about the, if you stand in anatomical position, so this part is the medial and this part is the lateral. Okay, so if I place my hand like this, again this part is lateral, this part is medial, but I am talking about only and only thumb. So in the perspective of the thumb, if this I do, this is the medial towards the central axis. This part is lateral. So simple and common sense. Medial, it is bounded by the extensor pollicis longus tendon. Laterally it is bounded by the extensor pollicis brevis and abductor pollicis longus. So extensor pollicis longus and extensor pollicis brevis, both tendon are close each other at the metacarpophalangeal joint. So at this point it forms as an apex. Okay, and the base is formed by the styloid process of radius. Okay, this is the radius bone and this is the styloid process. So this makes the base, and the floor is formed by the trapezius and scaphoid bone. And now you have to know about the contents of this anatomical snuff box. Mainly the radial artery, branches coming from the radial nerve and the cephalic vein. That's it. Very simple. So today's topics are up to this much. So see you soon. Till then, bye.